to go. Good morning, everybody, and welcome to Ask a Doctor, our twice a week live YouTube stream where we look to questions for you, the audience, to ask us anything health related, prevention, wellness. I sit here with Dr. Ellithorpe every Wednesday at 9:45 a.m. Pacific, and Dr. Ellithorpe also makes herself available on Monday afternoons, early evenings, around 6 o'clock, and that tends to be a little bit longer time where she can get a little bit more in depth. So if you're not already joining us on Mondays at 6 o'clock Pacific, go ahead and join us then. This is meant to be information for education, expositional, and just a discussion on questions on how, if we had a question like yours in our office from one of our doctors, how would we generally approach this? But of course, this is not meant to take the place of your relationship with your healthcare provider. This is not meant to be specific medical advice. So please do maintain a relationship with a healthcare provider and follow up with them on any specific questions you have. Of course, we're welcoming new patients here at our office in Orange County, California. We have 5 wonderful providers here who all practice medicine from a functional, integrative perspective where we look at the whole patient head to toe and we consider all factors of your lifestyle, diet, conditions that could affect your health, and we want to lead you on a course to reversing any kind of issues that you have and preventing any future ones coming from a scientific perspective and many, many years of experience with nutrition, which just tends to be, let's face it, very controversial, and unfortunately most physicians who we turn to for advice on nutrition and how we should eat, what we should eat, they're just not educated on this. So our doctors have dove deep into this. They've done the research. They're continually, and we are here at this clinic even, producing publications and research and looking to see what really works and what's effective, not what's trendy or what's hit right now. Although we do see things come full circle, don't we, very often. We've been preaching the gospel of low carbohydrates, avoiding sugar, avoiding processed foods, the benefits of fasting, and now those have become very popular, and there's lots of diets and programs out there that follow those, and it is nice to see the shift towards that because we've been talking about that here for many years.
Right.
Okay, this is meant to be interactive, not us just two talking heads up here. So the way you can interact with us is one of 2 ways. If you're logged into YouTube, you can post a question in the chat section, and that's the best way for this to make this a live interactive event. The chat is over here on the right-hand side of your YouTube video. You can, if you're logged in, you can post questions there. I already see some coming in, and I will ask the doctor those questions. If you don't have access to that or logging into YouTube, you can email your questions into us. And I do have quite a few that were emailed into us this last week. Our office email is office@tlcdoctors.com. That's TLC for Test and Longevity Center, doctors, plural.com. How you doing today, Dr. Ellithorpe?
I'm blessed.
I am too. Very excited. We've brought on a couple new people here at the office, and they're doing great so far. Today, we brought on Terry Delha, which is going to be your nurse supporting you with your patients, helping with your prescription refills. Very excited to get her started. So if you're one of our patients here, you'll see Terry over in the IV department over here with Dr. Ellithorpe as she's onboarding. And we also have some new people in the front office and the back office as well. So it's a good day. All right, why don't we jump into it? I see some questions here in the chat section. Shall we? Okay, I've got a question here from Sean, and Sean says, Doctor, can you please explain what argentin and colloidal silver is, their usage and benefits? I've heard you mention them in the past and would like more information. Thank you for all you do.
Yes, thank you, Sean. Colloidal silver is a method in chemistry where you can solubilize silver into a solution. It tends to be more clumpy and bigger molecules in a colloidal solution. The argentin silver is a nanoparticulate solution.
It's a hydrosol.
Right. And this dissolves the silver particles in a much more uniform disbursement throughout that solvent. And so I use the argentin silver for that reason. It's not to say there isn't benefit from colloidal silver, which is readily available over the counter, but the increased dispersion of the silver molecules in a hydrosol nanoparticulate solution like Argentyn silver is more effective. I use it every day. You know, before I come to work, I rinse my nose most often, or at least at bedtime, with a nasal squirt of Argentyn silver. And this has been proven in research to kill bacteria, fungus, viruses, and it's that reason for its better medical and efficacious kill, you might say, for all these materials. Over the counter, there is a half-strength product.
Yes.
What's the name of that?
It's called Sovereign Silver.
Sovereign Silver.
Same people that make Argentyn, it's just not the professional strength.
All right. So, but we carry the full strength. I don't think you can get this over the counter. So doctors have the full strength. We have it here as a nasal wash. We have it as a mist spray. We have it as a dropper. We have it as a gel that you can put on application. We have it in large, small, many forms. And I found it very, very valuable for all kinds of sore throat, sinus rinse, eye irritation. I have even, when I would start to get a cough, I would spray the mist and I would inhale. And that has worked for me to keep me at work all the time without missing days of work. So hopefully that answers the question.
Yeah, and I'll just add a little bit to that. I have a personal testimony with the Argentyn 23. When we first found out about it, we were, if you remember, out of town in Salt Lake City at an Integrative Oncology conference.
Oh, that's right.
And I came down, I hardly ever get sick, praise God, but I got a terrible sore throat. Do you remember?
Yes, I remember.
I was sweaty.
You had the patchiness on it, the white...
I thought it was strep, and I was out of town, stuck without access to all of the tools that we have here at the office, and there was a booth, they were talking about Sovereign Argentyn 23. There are providers that even put this in IVs, as do we with one of our IVs here. And I was talking to the guy, and he said, just here's a bottle, take it, spray it in your throat, and do this, liberally throughout the day. And my sore throat cleared up almost
within a day.
Even within the first hour or so, I started to get relief. It's going to kill viruses, bacteria. It's an antimicrobial as well as anti-inflammatory. And you were alluding to the nanoparticles. Since it's such a small size, it really helps it perfuse into the tissue versus being the clumpy. And silver's been around a long time in Roman times.
Thousands of years,
They would store things if you were wealthy enough, in a silver vessel because it helped keep it clean and last longer.
You can go on YouTube and see a picture of taking a silver, pre-1965 silver coin, and they put it in a glass and pour milk in it, and then they put another glass and they pour milk in it without the coin. They come back a day or two later and they show that the milk doesn't curdle in the one with the silver in it. And Bethesda, Maryland did research in 2009, publications on nanoparticulate silver with killing off Ebola. So it's very interesting.
And not to be confused with, you mentioned colloidal silver, which has been around for centuries. There is some concern if you ever look up silver on the internet, you'll see warnings about argyria, which is a condition where if you take a whole lot of silver, it gets deposited in your tissue, and you actually can your skin can start to turn blue. That's obviously not anything that's quality made, and you'd have to take such large doses. That's not a concern with the silver hydrosol.
No.
Okay, I hope that answered your question, Sean. And the name of that item is Argentyn 23. That is a professional strength over the counter. It's called Sovereign Silver. Okay, we have a question from Pamela. She says, how can I gain weight on a paleo diet?
Well, there are 9 calories in every gram of fat. There's 4 calories in a gram of protein and 4 calories in a gram of carbohydrates. So if you want to gain weight, you would want to eat a higher calorie dense diet, and that means you need to increase the fat in your diet. So that's the direction I would go.
Right. I have a hard time putting on weight myself. I have a faster metabolism, but when I increase my calories, specifically just load my diet with healthy fats and do resistance training where I'm lifting weight, and then we monitor our body composition on our BIA machine here, the InBody, I can see that I'm gaining the right kind of weight, not putting on fat.
There is a what is it? Perfect Aminos. It's a powder and a caplet kind of thing.
Tablet or a powder.
Yeah, tablet or a powder. And using that twice a day, I like it as the powder.
Yes.
So that's another way to help stimulate healthy muscle and mass.
That product, they did a study on that with cachexic cancer patients who have often a hard time. Their body is just emaciating, wasting away, and they found that by supplementing their diet with perfect aminos, they were able to maintain their lean body mass or even put on lean body mass.
Yeah, so that's what you have to do.
Okay, and that product is called Perfect Aminos. Okay, we have another one from Sean. Can you discuss the causes of hair loss as we age and what an integrative approach might be?
Well, that's the $64,000 question. Aging is a process where you are having all your cells stressed with getting enough blood supply, removing waste, getting their nutrition, and having enough water to deliver it to the capillaries. So in your scalp, you have to have these capillaries. As you age, your body is going to start automatically diverting essential nutrients, minerals, and such like that to critical organs. Your hair, your nails, some of your skin quality is certainly not life-threatening. So there is the hormone loss, thyroid, hypothyroidism, and in some cases hyperthyroidism. There is also the enzyme. If you make, as a man in particular, certain enzymes in excess, the alpha reductase enzymes tend to make more dihydrotestosterone. Same for women. Women can make more of that too. And this tends to hit or be associated with, I don't know if they've said it was causative, with hair loss. So the best thing to do, there is minoxidil. For some reason with minoxidil, topically as a scalp ointment, it seems to be associated with increased hair growth. There are certain nutrients, biotin, and other minerals that are valuable. I have never found any one item that seems to be the end-all be-all for that. So I'm always saying we're in a carbohydrate-drenched, pimped society, and your hair is not made of starch. It's made of protein. And you have to have good digestion to digest it, and your digestion diminishes with age as well. So a digestive enzyme emphasizing the proteins like perfect aminos, making sure you're drinking enough water to get the hydraulic pump of that to your scalp, and then maybe see a doctor, check your thyroid levels, check your dihydrotestosterone level, and after that, and with maybe a consultation with a dermatologist if there's anything new. I know of nothing else that is associated.
Yeah, and just to recap a little bit of that and put it into layman's terms, hair loss is something that we hear a lot in this type of medicine, and especially the age of patients that we're dealing with here, Sean. It is a multifaceted approach, as the doctor was explaining. We're talking about hormones, diet, inflammation, digestive enzymes, just a myriad of different things. We do have a lot of success with patients that are losing hair, a lot of women as well as men, by balancing their hormones, their thyroid, adjusting their diet. Those things alone will get you a long way, improving the microcirculation with things like chelation therapy. And then there are other options out there as well too, other therapies that we don't necessarily do in this office, like there's prolotherapy, where they do small injections on the scalp. Yeah. But as we age, hair leaves the places where we're used to seeing it, and it goes boldly where no hair has gone before over the body, and that's part of getting older. Yeah. And part of what we do here is try to slow down the aging process.
I've heard that, or I think I've even read certain saunas, infrared sauna, and they put the infrared light
There's
over
light
there.
therapy on the scalp.
Light therapy.
Yeah.
So people who do saunas 3 times a week or more have a better hair growth. So I have a sauna,
Yes.
and I use that regularly. People who exercise will have better blood flow. But we have a product. The only one that I found helpful is Regenamax. Regenamax is a multivitamin nutrient for hair, nail growth, and skin quality.
Okay, Elliot has a question. Just wondering if you've heard of the dietary supplement manufacturer Life Extension, and if so, how are they thinking to get their 2 per day multivitamin?
I know of the Life Extension program. I know of their founder and such, and they have been doing this for quite a few decades now, and I'm sure that they're helpful and useful to their patients with their labs, and their supplementation is something more new that I did not know that they are starting to do so much. I can't speak to it because I haven't seen Life Extension nutrients in my patients come through, because when I do a micronutrient assay, I'm going to look and see if what they're taking is useful or not.
Right.
So I'm familiar with them at Life Extension. I am not, I guess I'm neutral about the whole situation. I don't like over-the-counter medicine, over-the-counter telemedicine, really. I like to see the patient, touch them, have a real encounter, and I believe Life Extension does a lot of this phone kind of consultation. And if that's all you can get, then do it. But I don't promote that.
Right. And certainly anyone watching has access to the things that our doctors recommend here as far as a multivitamin goes. We can't offer all that we prescribe to our patients to the general public, but available on our website is our preferred multivitamin, which is called TLC Energy Core. And TLC Energy Core is something that our doctors worked with a compounded nutrients that actually we know their sources. They've been tested, tried and true, and we saw a gap in the multivitamin field, and we went to create our own with selected nutrients. And this is a very robust, very good multivitamin that has wonderful things in it. That's TLC Energy Core. Orthomolecular is something that you'd have to get through a doctor after you've been a patient, but they make a supplement called Mitocore, and that's a very good
too.
Multivitamin.
So these things have to be tested. You have to give something, or if they're taking it, testing. Once you adjust it or supply something, you need to be monitoring the patient. So everything that we do is clinically tested.
Lily has a question. Oh, and I see you, EH. I'll get back to that one. What allergy tests do you use that are most accurate?
I use immunofood, and the reason is that's the only test they've done for about 47, almost 50 years now. They're in Fort Lauderdale, Florida. I've been out there with you. We've been out there together because we fly out to the places that we use as our suppliers and sources. We check them out, and I can tell you it is a very difficult job to do IgG antibody food allergies. And they do split sample in-house testing, so that when a sample comes in on a periodic basis, they are split sampling it, and they'll track that unbeknownst to their employees. And at the end of it, they do an in-house quality assurance, and they look to see if those 2 samples produce the same results. And so I know the place, I know the owners, and so IgG food allergies of immunofood allergies is what I use.
And IgG, of course, is the low-grade markers. If you just go to any doctor or primary care physician and say, I want to do a food allergy test, they're going to be looking at your IgE, which is your immediate reaction. I ate a peanut, it's in my throat swelled up,
right,
or I got stung by a bee. That's IgE coming in with huge amounts of reactions and antibodies. IgG, we see that's the chronic things that you would not necessarily know that you're sensitive to.
Right.
But what a difference it makes. Again, this is something I did. It made a big difference in my life when I learned the foods that my body is sensitive to, and I avoid those foods regularly. I just feel so much better. And the name of that company that we work with, again,
Immunofoods.
is Immunofoods. Yes. Okay. Another question from Lily, then we'll get to EH. What is the beginning dosage of EDTA? How to bring down autoantibodies, TRAB and TSI for Graves' autoimmune disease. So EDTA is chelation therapy. I forget what EDTA stands for.
Ethylene diamine tetracetic acid. Well, that's improving your microcirculation. If you're having Graves' or thyroid autoimmune disease, that's a multi-pronged approach.
Right.
And so food allergies need to be tested. A very simplistic one-menu day should be instituted. You'll need systemic enzymes. And EDTA chelation will improve and enhance or more quickly create a microcirculation to promote healing of the gut lining so the inflammation can go down. But if you have serious Graves' disease, you should be seeing a doctor who may have to give you some prescription medicine that will help manage this and monitoring your progress. So you have to understand we are standard doctors, and there are standard medicines that are valuable to be used in the practice of medicine to help restore health or manage a disease process. So it would be a combined effort. That's what we would do. The smallest amount of EDTA that I would probably use is
750.
Maybe 750 milligrams intravenously, or if they can get the suppository form.
Right.
So we have a standard 1.5 gram.
Right.
You could push it if you do a special body mass calculation and kidney function called the Cockcroft calculation. But in general, you need to be seen by a doctor who can help manage all these facets, and may need to consult with an endocrinologist and see if you need some prescription medicine in your management as well.
Okay, EH asks, Doctor, can you please talk about the supplement Cerevive and Serenity, which I found on your shelf right here. Is it okay to take all those B vitamins in excess of daily IU, that's international units, and in combination with other supplements?
The answer is yes, because they're water soluble,
Yes.
so you can't overdose with them. These items, Serenity PM and Cerevive, were designed to help with calming your mood, your nervous system, to help you with sleep at night. So all these B vitamins in here are just quite safe.
Supportive of stress,
yeah.
adrenal support.
Yeah.
Right, along with a couple other
Herbs that
help with that as well too. Right. And our physician assistant, PA Patel, she actually went through a program where she really, I would say, specializes in adrenal recovery, stress management.
Right.
And these are some products that she leans on very well and are very effective. I like the Serenity PM for calming down at nighttime if I have any trouble falling asleep. Okay. So short answer, B vitamins, your fat-soluble vitamins are going to be D, E, K, and A. That's vitamin D, vitamin E, vitamin K, and vitamin E. Those you can technically overdose on, so a doctor is going to manage how much you take of those. But your B vitamins and other vitamins are water-soluble. If you take too much of them, you're just going to pee them out, which of course your body will metabolize what it can metabolize. No risk of overdosing on those. Okay. EH says, what are the above mentioned supplements for? I think we covered that. Yeah. That's adrenal, stress,
mood.
Mm-hmm. Genesis says, I've been using colloidal and sovereign silver for 13 years. I can't be without my silver. Yep, it is really great stuff. They have a gel form, a spray form, a nasal spray, which I love taking the nasal spray. It really helps coat the sinuses in the back of your throat even. They have a dropper. I'll drop it in my eyes or spray it in my eyes. Good stuff. Okay. Azar says, hi, beautiful Dr. Oglethorpe. I read if women use hormone therapy, estrogen, they will cause Alzheimer's. Is it true after age 65?
That's absolutely not true. In fact, to help the brain perform cognitively in a better manner is the use of natural hormones. So all the patients that I've had with Alzheimer's or dementia, I actively put them on natural hormone.
Yeah, quite the opposite.
Right. So whatever you read, they're totally off. That's totally wrong.
Yeah, and we see a lot of misinformation from coming from the health community with doctors that really just haven't been trained on bioidentical hormones or hormone therapy. So poor studies done out there or just misinformation. Mm-hmm. We are very, very comfortable with hormones, and we see them extending life and preventing or reversing disease. Quite the opposite.
Right.
Okay, Andre says, hello, I thought you mentioned recently clinicians' preference oils that can be used with eczema. Is the capsule form the same as the liquid in the bottle? Can the capsules be broken down and applied to the skin?
Yes. Yes to both of those answers.
Yes and yes.
Yes and yes. And I had a call, I think it was on Monday, about a baby that had terrible eczema, and that's not unusual. And that's a fatty acid metabolism deficiency. And giving a half teaspoon in the orally and using it liberally on the skin where the eczema is very valuable. Yep. But not all eczema is
just dry skin.
Yeah, dry skin from fatty acid deficiency. Usually that's what it is in an infant. You got to check your vitamin A level and
food allergies.
Yeah, food allergies is what I wanted to get to. But yeah, they're identical, and I would use them both.
Gut inflammation can create eczema. Yeah, eczema is one of those things that a doctor really needs to look at anything and everything that can be causing it. But certainly it can be used topically. These are just, if you read the ingredients on it, it has flax, pumpkin, linolake, sunflower oil, evening primrose oil, extra virgin coconut oil. So these are plant-based fats, and we like these versus fish oils because fish oils are kind of the waste product of the fishing industry, and they're very heavily focused on EPA and DHA, which are not essential fatty acids, although they're labeled as that all the time. Right. The only essential fatty acids are
linoleic and alpha-linoleic acid.
Exactly, which this is loaded with. This
is a bilipid membrane right here, and you can see clumps of cholesterol. We need tons of it. This is the protein transmembrane receptors. But these critical fatty acids have to be in your trillions and trillions of cells. This is that very special alpha-linolenic and linoleic acid, and if we are processing and eating processed food all the time, cooking with
damages these.
Yeah, it just destroys it. It makes you easier for viruses, bacteria, stress, aging to break down your cell membrane. So that's why I use these. I know Professor Peskin, who went over this, and so this is how critical it is. Your cell membranes need a ton of it.
All right, we are almost out of time, and we haven't even gotten through the chat questions, but fear not, we will definitely save these questions. I haven't even gotten to the email questions, so we'll save these. Dr. Althorpe will be back Monday at 6 o'clock to just jump right in on any questions that have not been answered yet. I did see several questions come in over the last 2 weeks about monoclonal antibodies. You want to talk a little bit about monoclonal antibodies, what they are, and where we're at and what we're thinking or considering with them?
Yeah, Regeneron is a company that puts out the monoclonal antibodies that are very useful to help attack the viruses, not only just COVID-19, but other system invasion from viruses. And this is, you're going to make your own antibodies to try and fight off future viruses. So if we have these antibodies and are able to deliver them in at the onset of an illness, so there's a window there. You don't constantly shed virus. It's usually you're infected, you get a fever the first few days, and then you start becoming contagious with viral expression for about a week, 5 days to a week. So in a 8-day window roughly is when you want to get your Regeneron or monoclonal antibody infusion. And I know there are places like Hoke Hospital. We also are looking at getting involved in having that in our IV clinic as well.
Right.
However, I will say high-dose vitamin C intravenously is antiviral. So I just had someone call me last night at home, and they're not feeling well with a fever, and so I'm sending them to get a 25-gram super immune boosting and to repeat it the next day probably. So there are many things we can do, take your D, eat a low-carb diet, and so forth. So hopefully that answers it.
I do want to get to one more question with the last minute we have here that I think will be easy to answer. Lisa writes, I've been in the lab recently and noticed that in each room there's an air filter. Does Dr. E recommend any air filters for home use, and if so, which brand? And where's the best location in the house if only one is affordable? Thank you so much. So before Dr. E chimes in, I'll just mention, since I'm the one that got them for the office here, we were looking for air filters that were affordable, that had HEPA filtration, that will filter anything below 0.3 microns. Now, of course, and this speaks a lot to masking and effectiveness of masks. Viruses are much, much smaller than 0.3 microns. However, when we're breathing or we're talking, the viruses aren't just coming out and floating in the air. They're usually attached to things. So we got this particular air filter, one, because it's HEPA. Number two, it has UVC, which kills any kind of viruses or bacteria as well too. Although I'm not sure if there's been any hardcore studies done on their effectiveness. We just, out of an abundance of precaution, and to make patients comfortable and make the air smell better and grab anything that could be causing allergies, and yes, kill some viruses, we got the it's called Germ Guardian True HEPA, and the model is AC4825E. That's Germ Guardian True HEPA AC4825E. We got it off of Amazon. I think they're roughly about $80, and we just loaded up on a bunch of those and we put them in different, I think it covers, each air filter they say is about 100 square feet of floor space, so we liberally put those throughout the office, and we have those running throughout the day. Do you have anything to say about air filtration or things that you like?
I think you did an excellent job. I don't have anything to add to that.
Lisa, they do make air filters that you can attach to your HVAC system that will spread it through the whole house. So if you're looking for your best bang for your buck, you could look up just local HVAC companies and find something that's HEPA filtration. Maybe they have a UV light as well too. I know we were recently looking at upgrading our system, so that might be the best bang for your buck. But I think about the time where I'm spending the most time in my house, and it's where I'm sleeping in my bedroom. So I do have one of these air filters running in my bedroom throughout the night, and actually like the white noise. It kind of helps drown things out. All right, everybody, we're a little bit over time. Thank you so much. Thank you for your questions. We really appreciate it. We love hearing from you and asking the doctor. That's why we created this, especially during these times where there's a lot of questions out there. So we're here twice a week currently, and we're in the process of producing more content that's going to be pre-recorded and covering topics. We have a room now that is built out for that. If you haven't already, subscribe to the channel. That way you can see what you've missed, what you've watched. That helps our channel out as well. You could do something for us as well too that doesn't cost you anything but a click. If you like the video, hit that thumbs up button. That gives us feedback as well as helps out with the YouTube algorithm. So
I'll take these for Monday.
For Monday.
Then.
I'm going to leave your, there are several email questions here, and if we didn't get your chat questions answered, I'm going to copy those down so Dr. E can start with those Monday at 6 o'clock Pacific time. Until then, everybody, be well, take care of yourself. We'll be back on Monday. If you're local in Orange County, feel free to call us and make an appointment, either telehealth or as always, in person. Until then, God bless everybody.
God bless.
Be well.